lady. Good afternoon, Mr Gething. I represent the COVID-19 Bereaved Families for Justice Cymru. Can I start with the topic of testing for healthcare workers? And we're looking here at the second wave, so autumn and winter of 2020, just to give you a bit of the evidence first. So on the 16th of November, the UK government introduced testing through lateral flow tests in England for all healthcare workers in hospitals. However, it was only on the 4th of December that you announced that the Welsh Government would roll out testing of healthcare workers from the 14th of December 2020. But it was widely reported by the BBC, in part following comments from the British Medical Association, that in Wales, this lateral flow testing didn't really roll out properly until around mid-March. So given that evidence, and that's the evidence that's before the inquiry, just so you understand, will you accept today to the inquiry, and indeed to all those affected by these decisions, that the Welsh Government, and indeed you as the responsible Minister for Health and Social Services, failed healthcare workers in Wales, firstly in not giving them access to lateral flow tests at a time when we know they were available in England from the UK Government, and secondly in failing to ensure that healthcare workers actually got those tests in a timely manner? So will you accept that today?
So I need to look at not just the decision making, but what's happening at the time with practical access to devices and how and when information was shared about the access to them, because during the course of the pandemic, Dr. Orford regularly updated us on some of the changes that were being made to try to have point of care testing, so reliable test device that could give you a result in a short window of time, not the overnight testing that otherwise had happened. So I'd need to look at the detail of what's in the evidence before the inquiry about when that information is available, about both the fact that there is a reliable device, then how it's been procured, because I think these were procured through the national testing programme run by the Department for Health and Social Care in the UK Government, then how our share is then used and where they're distributed. I've seen the reports around where they reach people at different points in time, but I'd need to understand where and how that problem was in the system, whether it's widespread or individualised.
I don't want to interrupt because we've got limited time. Just to focus you though, will you not accept though that Wales was at least a month behind the UK Government in introducing lateral flow tests, and that this was an unacceptable delay? Will you not at least accept that?
Well,
a month behind.
I'd need to have a look at the evidence directly on when they were available and how they were distributed, and also, of course, the access to alternative tests, because testing on the PCR overnight tests were available through that time as well. So I'm not trying to be difficult. Not
accepting it. Okay.
I'm not trying to be difficult, counsel. I just don't want to be manoeuvred into a corner to accept something when I can't see the advice and the evidence you're basing the question and the proposition.
Let me move on to the next topic then. Fair enough. Let me move on to face coverings, okay? So let me situate you. This is your 9th of June press statement, and I'm sure you recall that. As you will know, this was a significant statement because this was the first time the Welsh Government were recommending face masks to the public in Wales where they couldn't socially distance. I know you're looking at your witness statement. It doesn't really feature...
No, I was looking at the new documents that were provided during the course of the hearing.
I don't think it will be that. But if you just listen, it's obviously the first time the Welsh Government are recommending face coverings, and indeed yourself are recommending that. It's also significant because 4 days before, as you'll recall, the UK Government had mandated face coverings on transport. So this was there was a lot of divergence in face coverings, as you know, with the UK Government, but this was a significant one because it was going to be mandated on trains in the UK, in England. So what that meant is you could be taken off a train and given a fine in England if you didn't have a mask on, but that, of course, wouldn't happen in Wales. One more bit of context. This was happening because the World Health Organization had changed its guidance, and it was telling governments to recommend face coverings. Now, the inquiry has heard, as you know, from Frank Atherton, and he's accepted that his advice and the Welsh Government decision to diverge on face coverings became confusing for the Welsh public and weakened public messaging in Wales. And Anne John, the behavioural scientist from the TAG subgroup RCBI, also told the inquiry that the Welsh Government's approach was confusing and damaging to public trust, and she stated that a Four Nations approach would have been better. So, first of all, do you agree with the evidence of Frank Atherton and Anne John?
Yeah, I think on face coverings, if we'd had a more engaged four-nation conversation, we could have reached a four-nation decision. As this and on other matters, the more engagement we could have had, you reach compromise and trade-offs, but the benefit you get is consistency for the public.
Well, the CMOs were engaged, you see. The CMOs were all talking to each other. So did you probe Frank Atherton, who was obviously giving you advice along with TAG? We know that, to understand whether he had sought any behavioural advice for the theories that he was coming up with on the three harms, or from TAG RCBI. So did you question him as to whether he had any advice that was different from what the other CMOs had to justify divergence?
So we had a number of conversations, myself and the First Minister and the CMO, around the advice around face coverings and the position that we're in. I know some of this is in my statement. I think some of this in the First Minister's statement as well. And to be fair, Dr. Atherton has recognised this was a live conversation, and he was not persuaded of the evidence at the time that masks would be a positive addition to what we were doing. And again, he's reflected in his evidence to this inquiry that in hindsight, he would give different advice now. And I think that's honest. And we were well aware of the challenges on transport, on buses as well as trains, actually, on masks.
Can I ask you then, about your public statement? I've listened to it. It's obviously available. You don't explain to the public, do you, why it is that the Welsh Government is taking a different position to the UK Government? Do you not agree that in not explaining why you're doing something different and addressing that you weakened public messaging, that you undermined public confidence in the science, and in all likelihood, you probably risked encouraging non-compliance with the rules because you didn't grapple with divergence? Is that a fair comment?
No, I don't think it is a fair comment. If you look at what we were doing on the 9th, where we'd advised people it would be useful to wear masks in enclosed spaces, and again, reiterating the advice around masks where there are health and care is being provided. That's what we did. And the process to then get to having those as mandatory, we'd moved from saying, actually, these are useful things to do. So we're guiding the public to make their own choices. And I think actually most people welcome it. We then moved to actually having it mandated. And of course, we end up sometime later where we're still mandating face mask usage in closed spaces when the UK government aren't. I think when it comes to public trust and confidence in messaging, this is one issue. Look at the overall sweep. The reality is that the great majority of the public were coming with us through the summer on the pace of easements.
Okay, I'm going to move on. Sorry to stop you, but as I said, we have got limited time. The next issue I want to ask you about is medical masks for vulnerable groups, because the other significant thing we know is in the WHO advice in June is that those who are over 60 who are vulnerable with comorbidities, the WHO is saying that they should have access to medical masks where they cannot socially distance. I'm going to ask you, first of all, to look at some TAG advice from the 8th of June. So this is the day before your statement, please, because this information appears in the first draft of the TAG advice. So if we could get up, please, INQ 30s 327 606. And it's page 5. And that should appear on the screen in front of you. Do you see that there? That's the TAG advice on masks, coverings and medical masks. And you can see in the first paragraph there, it's in light of changes to policies in England and the WHO advice. Do you see that there?
I can see that, yes.
And if we turn over, please, to page 7, so this is a couple of pages down, we see at the top there, I'll read it to you, it says, there would be benefit of recommending and in certain circumstances providing medical masks to people who are more likely to have adverse outcomes from contracted COVID-19, e.g. shielding individuals, BAME, homeless, over 60s. And it says the effectiveness of medical grade face masks for personal protection is dependent on wearing them correctly, etc. So essentially there's a TAG advice, we know this is the 8th of June, which is essentially reflecting the advice of from the WHO. And if we just go down a few more pages for completeness to internal page 15, we can see the WHO advice there. If you look at that box at the very penultimate box line, settings where physical distancing cannot be achieved, an increased risk of infection and or negative outcomes. Do you see that there? It says a vulnerable population, so over 60, comorbidities, and the protection that you need, according to the WHO, is a medical mask, isn't it? Okay. Now, what I want your assistance on is this. What we can see in the evidence is, between the date of this tag advice and your public statement the following day, there appears to be, and on that day of your public statement, the tag advice is published. The reference to medical masks is completely gone from the second tag advice. Of course, you're not saying anything in your public statement, are you, about medical masks on that day? So it's just to understand if you can assist with how that happened, and in particular, how the tag science advice came to be amended. So if I can ask you about a second document, please. And this is INQ 302155454. We just keep that up for the moment. This is, if we can go to the first part of the email chain, this is an email from Toby Mason on the 9th of June at 10 a.m. Do you see that there?
Okay. It's in front of me?
Yeah. So the context here is we know that there was a 9 a.m. meeting at which your press statement was discussed, and we've seen some WhatsApps between Shan Morgan and Toby Mason talking about how that meeting was a bit muddled. Do you recollect, were you at that meeting at 9 a.m. on the day you gave your press statement?
No, I would undoubtedly have been busy, but I wasn't in this meeting.
Are you sure about that? Or I just want to be very clear with you. Are you sure, or are you saying you can't remember now whether or not you're at that meeting?
Well, I don't think I was, because I was in a number of meetings, and look at these. I don't ever recall being in a meeting with Toby Mason and Lee Waters discussing this in the circulation list.
Right, well,
if I had my ministerial diary, I could be more clear about whether I was or wasn't there, what I was doing at the time.
Well, let's look at this email.
Do you have the diary available or not?
Well, no, I'm not permitted to put that to you, but I think this email probably will give you some assistance. So if we look at it, please, it's the 10 a.m. email from Toby Mason to Jane Runnacles and others. I'm really concerned about the handling of the 12:30 press conference following the 9 a.m. call. I don't believe that any announcement beyond a position on non-mandatory face coverings following the WHO change of position is deliverable in comms terms in a way that will not raise very significant questions from a large number of stakeholders and the public, including those brought up at the meeting. As raised at the meeting, the tag paper, which is the one we've just looked at, will bring with it a huge number of queries and demands for us to take a policy position with really major implications like the provision of medical grade masks to vulnerable people. Can we distill the announcement to a series of bullet points now and work on those urgently and agree with the Minister for Health and Social Services, that's you, isn't it?
Indeed, at that time.
That any questions beyond these, and specifically on the use of medical grade masks, will be pushed beyond today to the more detailed sectoral guidance developed with stakeholders, and a full tag report will be published once there's a clearer position on all the issues. So if we just move up for completeness, we then get a response from Lee Waters back saying, agreed, I think Vaughan's oral summary was defensible, but I think that releasing the paper at this stage is a hostage to fortune. So would you agree with me that it would appear, certainly from that summary, that you were at a meeting, certainly before then, this is 10 o'clock. You must have been, mustn't you? Because there's reference here to you giving an oral summary that was defensible.
No, I'm not at all sure what the things are referring to. That's why I asked for my diary, because I could then tell if I was in the meeting or not.
Okay. Well, I'm going to suggest...
I'm just trying to not to give you a misleading answer.
Okay. Well, it says here oral summary. So in whatever context, though, would you accept that you presented some sort of oral summary and you have given very clear advice that the tag paper on vulnerable people and medical masks that I've just shown to you needs to be pushed off beyond today. So in other words, it wasn't going to be told and presented to the Welsh public on the 9th of June. That seems to be what's being suggested in this email, isn't it?
Well, it's possible. And of course, this is one of the occasions where the scientific advice is actually linked to policy and development. Because if you say, this is what we're going to do, you do then need to say, and where will the deliverability come from, and at that point in time, not just the volume of masks of the right type, but how you get them to people.
Okay.
So if you're getting yourself to a hospital for the sake of argument, and you're in a vulnerable group, you can probably get a mask on the way, and as you do now on a regular basis. If you're getting the bus or the train and you need to have a mask, how do you get masks to those people? In the end, what we found was that on buses, for example, they ended up putting masks at the front of the bus so people could have them and
But
take
can
them.
I just pause you there for a minute? Because what I'm putting to you is quite serious. It's that TAG scientific advice was amended on your say-so and not presented to the Welsh public, when underlying that advice was very clear guidance from the WHO that vulnerable people needed access to medical masks. So that's what I'm suggesting to you. The scientific advice was amended on your say-so.
Oh, I see. So we've gone through this on a number of occasions where we had advice up to us to then be published.
Okay.
And the publication of the advice is to help inform the public about choices we have recently made. When we're still making a choice, then we would say that actually this is still policy in development, and we need to understand what we're going to do about it as well. So it sounds as if the accusation is that I'm deciding what the science is when I'm not. I need to be clear, though, as indeed does the whole government, that if we're saying we're going to make a change and here's the science that underpins it, you're able then to deliver against what that recommendation is. And I think that's sensible.
Just finally then on this topic before we move on, we can't find any evidence to suggest that the Welsh Government ever told vulnerable people in the community in Wales that where they were over 60 with comorbidities, that the World Health Organization was recommending that they use medical masks in the community. So is this right? Was this vulnerable cohort of people in Wales never told by the Welsh Government what the World Health Organization was saying that they needed? Is that right?
I'm really not certain, and I don't want to try to pretend I can piece through the documents to find an exact statement around that. We did, of course, issue lots of guidance around use of face masks. And, of course, one of the things we were being advised in the same science was actually to try to draw a distinction between masks and face coverings. And that was a distinction that never stuck.
OK, can I move on? I've got 3 minutes left, so can I move on to the fire break, please? Next, final topic. Dr Orford states in his statement that there were few occasions when Welsh ministers made decisions that appeared inconsistent with the advice offered by TAG. And he said a notable exception where the science didn't align with the important decisions included the post-fire break period, where TAG advocated for control measures that would keep rates of infection lower, but for different reasons this was not followed. And he tells us that the national population protections that were introduced after the fire break were insufficient to control the growth of the epidemic. So will you accept today then that you were part of a cabinet that rejected scientific advice that was given to you by TAG in autumn 2020 about how you should ease restrictions post-fire break, and that this led to measures being introduced that led to a resurgence of the virus? Will you accept that? Because that's what Dr Orford is saying.
I think you're characterising what Dr Orford said in rather more definitive terms than he did. If you look at where we were and the advice on the length and the depth of the measures in a fire break, the opportunity to reset, the gains we thought we'd make and what we thought we'd be able to in resetting public behaviour, that is bounded in with all those other harms that take place as well. And we had to balance and weigh all those up. And as I said in answering questions from Council to the Inquiry, the politics and the environment which we're asking people to make those choices have changed significantly and become much more contested, frankly, much more bitter. And unpleasantly so.
1 minute left. Final question. Were you ever made aware that the Swansea modelling team had results that showed that a 4-week fire break would suppress the virus deep into December? So that's a 4-week fire break. That if that had been employed, it would have suppressed the virus deep into December. Was that ever told to you as a minister? I know you were told about 2 to 3 weeks, but we were told about 4 weeks.
I don't recall seeing that. That doesn't mean that I didn't, but I generally don't recall seeing that. In all of the, the 5 Eva Arch files of evidence I've read, I don't recall seeing that. From what I'd seen at the time, I have seen a reference to it in the files I've read for this hearing, but I can't recall seeing that in September or October
Thank you very
2020.
much. Thank you, my lady.
Thank you very much, Ms. Evan. Mr.